an
Now, well,
implant.
what about the people that have bad gums? So, like, for example, a friend of mine, what about the people, though, they've been told their teeth have to go, dentures, dental implants, but, they say their gums are too bad
Okay.
to get dental implants?
As a periodontist,
I mean, that's true, right?
that's not true.
Okay.
My goal as a periodontist is to maintain the teeth in health and function for the rest of a patient's life. But if we determine teeth can't be kept, when you remove the tooth, and we use our laser to clean the area where the tooth comes out, we sterilize the area and the gum and bone heal. Sometimes we add bone. But even patients who have to lose their teeth because of advanced gum and bone infection will be candidates to have dental implants.
So when you remove the tooth, the gums get better?
When you remove the
infection
tooth
goes away.
and you clear out the area around the tooth, the infection goes away. I want to show you some other cases with dental implants. This gentleman here was missing 2 teeth on the bottom, and with the placement of just 1 dental implant, he was able to replace those 2 teeth. Sometimes we have patients who have been missing teeth their entire life. This is a young lady who is congenitally missing teeth, and in her case,
is that common as well?
I can tell you,
Born without those teeth?
I can tell you that that's the most common tooth for people to be missing.
Interesting.
It's the upper lateral incisors. Why, I have no idea. But in this young lady, we rebuilt the bone, and we're going to be able to place dental implants for her in a couple of months.
And you match them up?
We match them up. They're going to look exactly like the rest of her teeth. No, another point I want to make about this is that this young lady has been wearing a removable partial denture or flipper most of her life. And what has occurred is that she's been losing bone in those areas. So what we do at this point is we're able to rebuild her bone, and a few months later we're able to put in 2 dental implants that match her teeth exactly, and she gets to throw away that piece of plastic, which is kind of important.
And they feel like her own teeth, right?
They feel exactly like their own teeth. And she's going to go to school, and she's not going to have to take her teeth out at night. It's a wonderful.
Is that right? So these flippers, I mean, there's thousands and thousands of people in Florida with these flippers.
Exactly.
You say, come in, trade them in for getting, it's like getting your teeth back in a way, isn't it?
It is like getting your teeth back. And you said come in. I want to mention this. In our office, we do complimentary examinations, all the x-rays, digital x-rays, and consultations at no fee. So people can come in and spend time and talk with me, and we welcome them, and we work with their dentist or refer them to dentists if they don't have one, and we're able to change people's lives.
Now, we should mention Medicare does not cover dental implants.
Absolutely not.
Most insurances may look at, like a PPO, may take care of some of it.
Exactly right.
But, I know the cost, we've talked about it. I mean, it's less than, I guess, you would spend on trying to save a teeth with root canals and everything else, right?
But
in the long run, it's less.
Finances are important to everybody. And we realize that. We have different plans. We work with 3 different finance companies that allow patients to pay for their care over 7 years. Okay. So this treatment is affordable to almost everyone, and it changes their lives. Let me show you another case.
All right.
This is not such a young lady who is missing the upper tooth for many years, and what we're able to do is to put in a single tooth dental implant, and it's hard to tell which is the implant.
Yeah, you can't tell.
This is a very important friend of mine. This is a dentist, and he had a fixed bridge that failed. And what we did in his case is that
So I'm looking at the side of the mouth.
You're looking at the side of the mouth.
He's missing teeth, and he's
missing teeth. This was a bridge that failed, came out, and what we did was we removed his teeth, and we actually built some bone where the teeth were and in his sinus, and we're able to create an atmosphere where I could place 2 dental implants, and there's his mouth right now.
Now he's looking good.
He's looking good.
Dentists should not have holes in their mouth.
They shouldn't have holes in their mouth, and he's able to floss around them. They're like natural teeth. We changed his life, and he is a big, big proponent of our practice. He loves to send patients over to us. This is a young lady, not so young lady.
Oh my goodness.
And she had some implants done previously, but she has a mouth that's full of decay. And in one visit, we were able to remove the teeth and rebuild the bone for her. We came back a few months later, and we were able to put in dental implants, and she has a denture that doesn't move. And I can tell you with today's technology on those
So this right here is fixed?
That is not fixed.
Okay.
But with today's technology, I could take those same implants and make a fixed prosthesis for her.
So if you don't want something that never comes out,
yes.
Because we haven't talked too much about that option, but that's can be done with 4 or 6 implants?
Yes, if the implants are in sufficiently strong bone that we can get enough width and length of the implant.
Okay.
Yes. Not everybody can have fixed, though, because when you lose bone, remember this model, when you lose bone, the height of bone and the width of bone is greatly diminished. So sometimes you have to replace part of the gum.
But with these 4 implants, like in this picture, I mean, this is a woman that can chew and tear food, eat broccoli,
this
whatever.
is a very aggressive lady.
Okay.
And she can chew and eat whatever she wants.
Is that right?
And she's out dancing.
And you could use their existing denture, and you put fastens underneath them. And
correct.
Interesting.
There are techniques to that. We can use their existing denture. Sometimes that existing denture can be used forever. Sometimes it's changed later on.
Now, we are out of time. But
Already?
I guess time flies for you, right? You
Okay.
can talk about this all day and night. But if somebody's watching this
Yes.
and they're a denture wearer, they're missing any teeth, where do they begin?
They have to realize that anyone who's missing one, some, or all of their teeth, whether it be for a day or for 40 years, still can have a fixed or more stable restoration in their mouth. The denture wearer can have some implants put in to make their denture stable so they can function, go out to eat, dance, socialize, however they want.
Okay.
Person missing one tooth doesn't have to have the adjacent teeth ground down. Patients who are congenitally missing teeth can have those teeth replaced with fixed prostheses. Patients who wear removable partial dentures can have those dentures more stable with implant support, or perhaps we can even eliminate those dentures completely. Take-home message is that patients in our office are treated as individuals. We respect their time. You can come in and see us. We do all of our consultations and our examinations and radiographs at no charge.
At no charge. And your website, I mean, it has videos, different topics, very informative.
You know, our website's important because people can access it at any time, 24/7. On our website, we have printed information. And by the way, it can be in French or Spanish by a click of a
really?
button. Yes, you can. The whole thing gets translated. I don't know how they do it, but it can be done.
Okay.
And we have videos and information on every topic. We treat patients to keep their teeth. Remember, as a periodontist, my goal is to keep patients' teeth for their lifetime. So we do all kinds of procedures to help treat their teeth. We use lasers. We do cosmetic procedures for long teeth. We do cosmetic procedures for gummy smiles, and we treat denture patients. We treat denture patients. We treat patients who are missing one tooth, patients who want to have a better quality of life.
At your center, do they all get to meet you on day one?
Everybody.
You have a nice smile, by the way. I said, you know, are those your teeth?
These
I
are
asked
my
you that before we started.
As I told you, my dad was a dentist, and I had braces as a child, and a year and a half ago I had braces again because I had a little bit of shifting. But the smile's important to me,
Okay.
and it should be important to everyone.
All right, I want to thank you for coming on the program. Very interesting.
It's my pleasure. Thank you,
More
Randy.
dentures. Good,
Okay.
good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you could go online on our website at wellnesshour.com. Just put in Dr. Levine. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.